Howard Dean was at a healthcare town hall in Reston, Virginia, with Representative James Moran. After opening remarks by both of them, they did a Q&A with the audience.
I don't know. It's going to depend upon what it takes to get the best bill that we can out of the House. And I'm sorry I can't be more specific than that, but I'm going to work with the leadership to get the best bill we can. I used to be a sponsor of Chairman John Carter. John Carter is the chairman of the Judiciary Committee. I used to be a co-sponsor of his bill, but now that we have a bill that the White House has endorsed, my inclination is to support that bill. Bob from Alexandria. Bob from Alexandria. I think this is the anti-box. We're only going to have time for 2 or 3 more questions at the most.
Do you want to check my ID? Just because I sit over there doesn't mean I'm always agreeing with everything that everybody says. But I just want to take the time to thank you for doing this. It's been a tough crowd.
Thank you.
But I also want to point out that it is part of your job, and it's what we send you to Washington to do. Anyway, I appreciate it.
I'm not complaining.
As one of your
I'm honored to represent this area.
As one of your constituents, I wish you would have, who lives in Alexandria, wish you would have held this closer to my house in TC Village or something like that, but understanding the way things are, I'll ask my question.
Most of my town hall meetings have been held in Alexandria, Arlington, and I'm trying to be fair to my rest of the constituents.
Okay, Congress deals with Medicare costs by cutting fees to physicians and cannot otherwise seem to control the cost of the program. And by the way, the question about the deficit of Medicare, if you required the government to use the same accounting methods that you require public companies to use for their pension system, it would be way in the red. Okay. Why should I trust Congress and the government to run a national health care plan and be able to control the costs?
Ask your grandma about Medicare.
There's a gentleman here who has made a point of emphasize, name one government program that's been well run. Well, the fact is, when I have an opportunity to visit in other countries, unless it's the first world, Europe, Canada, other countries, the governments are relatively corrupt. They run the gamut, but the fact is we have the largest civil service system that is the least corruptible. And we have mechanisms if there has been corruption. Now let me give you an example of government programs that are, first of all, the military is a government program. Now, there was a decided effort to privatize military operations. Sir, hey, come on, we don't want that kind of stuff. All right, well, maybe you want to move the chair or something and stay on. But when we tried to privatize the last administration, we found that there are as many government contractors in Iraq as there were military and civilian employees. It cost us a lot more, and most of the abuses were committed by contractors. I work with the contractors very closely because we have a lot of them in Northern Virginia. But the reality is that firms like Blackwater and Halliburton and so on ripped off the government. Now, it went soldiers come home, I don't know any family that doesn't, ma'am, please. I don't know any family who has a wounded warrior who doesn't want them going through the Veterans Administration. Now, the VA is not perfect, but because we put a lot of money and we have good people, it provides good medical care for our veterans, and that is a socialized medicine system. Right here, let's try Peggy Connor. She's opposed as well. Okay, Ms. Connor.
Okay, I also work for the Innova.
You work for the Innova Health System?
Yes. I think it's important that we have privacy between our doctor and our health records, and it shouldn't be shared with the government.
This is a huge issue, and it's much more than about just this healthcare bill, because this isn't just about healthcare. You don't want the government knowing all your health information. You're not so crazy about having the insurance industry or your bank knowing all your information either, which then gets sent to all these credit card companies, and that's why you get all this junk mail. So this is a much bigger issue than healthcare, and healthcare is a pretty big issue. Here's what folks are struggling with, and I don't think this is what's cooked, and I'm going to give, of course, Jim the last word, but we want to have records that are complete, and patients get cared for better if the doctor who's taking care of them knows that it's complete. And so the president put in a lot of money in the stimulus package with the advanced medical records, so that if you get sick in some place that's 100,000 miles from your home, you can get, if you have the chip, you can carry the records with you. They can stick it in the computer. They can know all your situations. If you have been in a terrible car accident, you can't tell them anything. You have the doctor has the information. They know if you're on some kind of medication, etc. That's important. So what guards are there against privacy? And the guards are a bill that was passed about 6 or 8 years ago called HIPAA, which stands for God knows what, but it has something to do with health insurance for privacy. The problem is it's not enough. And there is no way it's enough. And this is a private sector problem as well as a government problem. Look, just the other day, there was some guy hacked into some credit card companies and stole 130 million credit card numbers. Those are our credit card information that's now in some crook's hands. So there is no really good answer to this. Because in this information age, there's going to be, and there already is more information available than most of us, at least in my generation, didn't grow up on Facebook, would ever be comfortable in having in other people's hands. On the other hand, the more information that your healthcare professionals have, the better it is. So the key is and this is an open question, because I don't think anybody knows the right answer to this. How are we going to build a wall between particularly the government, but also corporate America and ourselves, so that our private information stays private? But there are people who need to know our private information, and one of them is the healthcare professionals taking care of it. So this is a great question, unfortunately, for which there is no perfect answer. So I'm sorry to leave on that kind of a note. Let me thank you again. I've actually enjoyed this, and I hope Jim has too.
This is important, and as with every major transformative struggle that our society and economy has gone through, whether it was Social Security of the 1930s, whether it was the civil rights struggles of the 1960s, this should be difficult because it's important. It affects everyone, and we're certainly not going to get it right unless we hear from all sides. So I thank all of you for coming. Thank you for participating. And